Before we start, please remember that this video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always talk to your doctor or a qualified healthcare provider about any questions you have regarding your health.
Okay, so you've been told you have a pancreatic fluid collection. I know that can sound confusing, maybe even a little bit scary, but we're going to walk through this together, and I want you to know there's a really clear, modern plan to help you heal.
First things first, what in the world is this collection that your doctor is talking about? Let's get a really clear picture in our minds.
To put it simply, it's just a pocket of fluid that is formed near your pancreas. This usually happens after the pancreas gets irritated or inflamed, something called pancreatitis. It's actually part of your body's way of dealing with the inflammation.
Now here's a key thing to know. Not all of these collections are the same. It really helps to think of them as belonging to two different families, based on what's inside. And this difference is super important because it helps your doctors figure out the very best way to help you. So on one side, we have collections that are just fluid. The best way to picture this is like a simple water balloon. The medical name for this is a pseudocyst. Then, on the other side, you've got collections that are a mix of fluid and some solid bits. Think of a slushy, with the liquid and the little icy bits mixed in. We call that walled-off necrosis. Figuring out if we're dealing with a water balloon or a slushy is really the first step.
Okay, probably the biggest question on your mind is why? Why did this happen to me? And that's a completely normal thing to wonder. So let's talk about where these things come from.
Almost all the time, these collections show up after someone has had pancreatitis. Remember, that's when the pancreas gets inflamed, it can leak some fluid, and your body, in its effort to heal, builds a little wall around that fluid. So, you see, it's a known complication, and your team knows exactly how to handle it. The number one cause is a sudden attack of pancreatitis, which we call acute. But it can also happen with pancreatitis that's been around for a long time. That's chronic. Or sometimes if the pancreas gets injured, maybe in an accident. The main thing to know is that this didn't just pop up out of the blue. It's connected to something that happened before.
So we know what it is and we know why it's there. The next question is, what do we do about it? Well, this is where a really careful, thoughtful plan comes into play.
And I've got some really good news for you. A lot of these collections actually get smaller and disappear all by themselves, with no treatment at all. Because of that, our first step usually isn't to rush in and do something. It's to wait, watch you carefully, and give your body a chance to do its thing.
And this watch and wait period is so important. For about the first 4 weeks, that wall around the fluid is still forming and getting strong, kind of like how a scab forms over a cut to let it heal underneath. If we try to do something before that wall is good and ready, it can actually cause more trouble. So we wait until it's mature. That makes any treatment, if you even need it, much, much safer and more likely to work. So how do we watch it while we wait? We use amazing tools like CT scans. They give your doctors a perfect, detailed picture of what's happening inside. They can see how big it is, exactly where it is, and, you guessed it, whether it looks more like that water balloon or that slushy. All that information helps them make the absolute best plan just for you.
Okay, let's say that waiting period is over and the collection is still there or it's causing some issues. What's next? Let's talk about the modern path to healing, which is actually very gentle. The whole idea today is something we call the step-up approach. It means exactly what it sounds like. We always start with the simplest and gentlest options first. We only step up to something more involved if we really have to. It's a much kinder way of doing things than in the past.
So what does this path look like? Well, step 1 is all about supporting your body. We focus on giving you the right nutrition, maybe some antibiotics, just to help you heal. If that doesn't do the trick, we step up to a minimally invasive drainage. This usually means using a tiny, flexible camera called an endoscope to drain the collection from the inside. No big cuts needed. And then only as a very last resort, if those first 2 gentle steps don't work, would we even begin to think about surgery.
Then check this out. That second step, the minimally invasive drainage with a little camera, it works more than 95% of the time. That's an absolutely incredible success rate. It means that for almost everyone, we can fix the problem without ever needing to go near a big surgery. That's pretty amazing, right? Now, healing isn't just about what happens at the hospital. You are a huge part of your own recovery. So let's quickly go over what you can do at home to help yourself get better and stay better. It really boils down to 3 key things. Number 1, stick to the diet plan your team gives you. It's specially designed to let your pancreas rest and heal. Number 2, and this is a big one, you have to avoid alcohol completely. It's like pouring fuel on a fire for an irritated pancreas. And number 3,
Make sure you know the warning signs to look out for, so you know when to make a call.
And what are those signs? The most important ones are getting a fever, having chills, or feeling a new or really bad pain in your belly. Any of those could be a sign of an infection, and your team needs to know right away. Seriously, never feel like you're bothering them. That's what they're there for. Just call.
Whew, we've gone over a lot. So if you're going to take just one single thing away from all of this, what should it be?
It's this. Your healthcare team has a modern, safe, and really effective plan to get you through this. And you are the most important part of that team. Your participation and your voice matter. By working together, the goal is simple: to get you healed up and back to living your life.